Who do I target for screening? It's a great question. The nice thing about this is it allows for assessment of risk across different risk strata. And in fact, we've looked at this question within the data sets that we started with, and we can't see that it is particularly from a utility perspective more useful in different risk strata, which is not to say that the risk predicted is the same. Quite the contrary. Certainly, higher risk individuals, if they have an abnormal set of these panels, their risk is dramatic. And so, when we look at patients with diabetes, for example, a high risk CVE score in a person with diabetes has a 25-fold higher likelihood for a primary endpoint compared to those with a low risk score without diabetes. So, certainly it's well suited, as the slide says, for evaluation and management of individuals with cardiovascular disease risks, obesity, diabetes, prior established cardiovascular disease. To be clear, the presence of prevalent cardiovascular disease was not a factor with respect to the ability to either predict coronary obstruction or predict cardiovascular risk. And then, there are certainly other populations where these markers are of use. The so-called worried well population, who are highly motivated to reduce their cardiovascular risk as much as is possible. Individuals with cancer undergoing chemotherapy treatment. Rhonda, I don't know if you want to mention those data, but there's evidence that the CVE score may be prognostic from a cardio oncology perspective during treatment. And then longitudinal follow-up of individuals who either have risk or established cardiovascular disease. I'm aware of clinicians that are measuring these tests on a longitudinal level, serially speaking, and in fact, monitoring the impact of therapies on the results, with some results that aren't yet published suggesting that treatment with therapies to reduce atherothrombotic risk lowers concentrations of these markers.